So this will be the second mechanism of drug-drug interaction we're talking about. I'll be talking about pharmacodynamic drug-drug interaction. So first of all, before you understand the whole concept, you need to actually understand the individual terminologies used in it. First of all, what is pharmacodynamics, guys? Pharmacodynamics is basically how a drug interacts to the body. Do you understand? Pharmacokinetics is how the body interacts to the drug. So pharmacodynamics, the drug interacts with the body by actually looking for receptors, binding it, and all that. Okay. So if two drugs are interacting in the body and they are affecting how they interact to the body, it could be that these two drugs are basically competing for receptors. So one drug is inhibiting the other drugs and all those stuff. All right. There could be that these two drugs, as they are interacting, they are basically promoting the effects of one another. Do you understand? So it could be inhibitory or it could be promotory. The pharmacodynamics drug-drug interaction. We say that interaction involving the actions or effects of the drug. They are common and most have simple mechanism consisting of what? It's either summation, it's either promoting or opposition or inhibitory. Do you understand? It can either summate or it can actually oppose. Okay, so summation or opposition or summation or opposition of the effects of the drugs with respectively what similar or opposing action. Do you understand? So if the drugs they have the similar action, then they will summate. If they have opposing actions, then they will tend to like inhibit each other and all that. So interaction is non-specific because it depends on the effect of the drug rather than its specific chemical structure. Okay. So guys, what are the examples of this pharmacodynamic drug-drug interaction? So drowsiness will be caused by H1 blockers, antihistamine, okay? And if you take alcohol, this drowsiness will be exaggerated. Do you understand? Because H1 blockers, antihistamines already will make you drowsy. So when you take them with alcohol, then it will exaggerate it. So antihypertensive drugs are rendered less effective when used concurrently with what? Non-steroidal anti-inflammatory drugs, okay? Irrespective of the chemical structure. Now, this is due to the inhibition of the biosynthesis of vasodilators, prostaglandins in kidney, okay? So let's look at the last examples now. Drugs with negative ionic effect can precipitate heart failure when used in combination in patients with what? Supraventricular tachycardia. So this patient already have an underlying um, medical condition. Do you understand? So when you use these drugs with negative ionic effect, then it can just throw the patient into uh, heart failure. Okay, so examples of these drugs with negative ionic effect is what? Beta blockers and verapamil. Then warfarin is an anticoagulant, while aspirin is an antiplatelet. So aspirin causes gastric bleeding via irritation of the gut. A potential adverse effect can result when you actually combine the two drugs. Okay, so anticoagulant is stopping blood from clotting, then antiplatelet is making bleeding. Do you understand? So imagine a person is bleeding and the person has something that is promoting bleeding, something that is stopping the blood from clotting. Do you understand? That's an adverse effect. Okay, and this can be gotten when you use what? Warfarin and aspirin. Okay, so guys, these are the several examples of pharmacodynamics drug-drug interactions that we have in the body. Okay, so I hope you guys enjoyed this lecture. If you did, then I'll be seeing you guys in the next one. Bye for now, guys.